Food addiction, Wikipedia audio. A food addiction or eating addiction is a behavioral addiction that is characterized by the compulsive consumption of palatable foods, the types of food which markedly activate the reward system in humans and other animals despite adverse consequences. Psychological dependence has also been observed with the occurrence of withdrawal symptoms when consumption of these foods stops by replacement with foods low in sugar and fat. Professionals address this by providing behavior therapy. Sugary and high-fat food have both been shown to increase the expression of FOSIB, an addiction biomarker, in the D1-type medium spiny neurons of the nucleus accumbens. However, there is very little research on the synaptic plasticity from compulsive food consumption, a phenomenon which is known to be caused by FOSIB overexpression. Description: food addiction refers to compulsive overeaters who engage in frequent episodes of uncontrolled eating. The term binge eating means eating an unhealthy amount of food while feeling that one's sense of control has been lost. People who engage in binge eating may feel frenzied, and consume a considerable amount of calories before stopping. Food binges may be followed by feelings of guilt and depression. For example, some will cancel their plans for the next day because they feel fat. Binge eating also has implications on physical health, due to excessive intake of fats and sugars, which can cause numerous health problems. Unlike individuals with bulimia nervosa, compulsive overeaters do not attempt to compensate for their binging with purging behaviors, such as fasting, laxative use, or vomiting. When compulsive overeaters overeat through binge eating and experience feelings of guilt after their binges, they can be said to have binge eating disorder. Diabetes, high blood pressure, high cholesterol and triglycerides, osteoarthritis in the knees, hips and back, fungal infections and skin folds that are hard to clean, congestive heart failure, shortness of breath, coronary artery disease, death. In addition to binge eating, compulsive overeaters may also engage in grazing behavior, during which they continuously eat throughout the day. These actions result in an excessive overall number of calories consumed, even if the quantities eaten at any one time may be small. During binges, compulsive overeaters may consume between 5,000 and 15,000 food calories daily, resulting in a temporary release from psychological stress through an addictive high not unlike that experienced through drug abuse. Compulsive overeaters tend to show brain changes similar to those of drug addicts, a result of excessive consumption of highly processed foods. For the compulsive overeater, ingesting trigger foods causes the release of the chemical messengers serotonin and dopamine in the brain. This could be another indicator that neurobiological factors contribute to the addictive process. Conversely, abstaining from addictive food and food eating processes causes withdrawal symptoms for those with eating disorders. The resulting decreased levels of serotonin in the individual may trigger higher levels of depression and anxiety. Eventually, compulsive overeaters continuously think about food. Food is in the preeminent positions of their minds. When deprived of it, the person may engage in actions similar to those of hard drug addicts, including an uncontrollable search for the substance, and in devious behavior, such as stealing or lying. The problem of obesity is becoming a worldwide problem. A sugar tax is set to be introduced in Ireland to minimize the consumption of harmful foods and drinks. A food addiction features compulsive overeating, such as binge eating behavior, as its core and only defining feature. There are several potential signs that a person may be suffering from compulsive overeating. Common behaviors of compulsive overeaters include eating alone, consuming food quickly, and gaining weight rapidly, and eating to the point of feeling sick to the stomach. Other signs include significantly decreased mobility and the withdrawal from activities due to weight gain. Emotional indicators can include feelings of guilt, a sense of loss of control, depression, and mood swings. Hiding consumption is an emotional indicator of other symptoms that could be a result of having a food addiction. Hiding consumption of food includes eating in secret, late at night while everybody else is asleep, in the car, and hiding certain foods until ready to consume in private. Other signs of hiding consumption are avoiding social interactions to eat the specific foods that are craved. Other emotional indicators are inner guilt, which includes making up excuses to why the palatable food would be beneficial to consume, and then feeling guilty about it shortly after consuming. Sense of loss of control is indicated in many ways, which includes going out of the way to obtain specific foods, spending unnecessary amounts of money on foods to satisfy cravings. Difficulty concentrating on things such as a job or career can indicate sense of loss of control by not being to organize thoughts, leading to a decrease in efficiency. Other ways to indicate the sense of loss of control are craving food despite being full. One may set rules to try to eat healthy, but the cravings overrule and the rules are failed to be followed. One big indicator of loss of control due to food addiction is even though one knows they have a medical problem caused by the craved foods, they cannot stop consuming the foods, which can be detrimental to their health. Signs and symptoms. Food addiction has some physical signs and symptoms. Decreased energy, not being able to be as active as in the past, not being able to be as active as others around, also a decrease in efficiency due to the lack of energy. Having trouble sleeping, being tired all the time such as fatigue, oversleeping, or the complete opposite and not being able to sleep such as insomnia. Other physical signs and symptoms are restlessness, irritability, digestive disorders, and headaches. In extreme cases, food addiction can result in some suicidal thoughts. A food addiction, especially long-term, can result in negative consequences to all aspects of a person's life, creating damaging and chronic symptoms. The short-term physical effect associated with dopamine and endogenous opiate release in the brain reward center is low-level euphoria, a decrease in both anxiety and emotional pain, also known as a food coma. The long-term physical effects may vary. The health consequences can be severe. If a food addict has obesity, it can be associated with the following. Obesity has been attributed to eating behavior or fast food, personality issues, depression, addiction, and/or genetics. One proposed explanation of epidemic obesity is food addiction. The psychological and mental effects can prove intense and plague an individual for years. These include hopelessness, powerlessness, isolation, shame, depression, self-loathing, guilt, suicidal thoughts, suicide attempts, and/or self-injurious behaviors. Potential negative effects. Physical consequences. Food addiction impacts relationships, especially those within the family. This is because the person with the addiction is vastly more involved with food than with people. It becomes their safest, most important, and meaningful relationship. Other connections to friends and family take a back seat. This often leads to a deep sense of isolation from others. Psychological consequences. Relational consequences. Management. Prognosis. Epidemiology. Compulsive overeating is treatable with nutritional assistance and medication. Psychotherapy may also be required, but recent research has proven this to be useful only as a complementary resource, with short-term effectiveness in middle to severe cases. Lisdexamfetamine is an FDA-approved appetite suppressant drug that is indicated for the treatment of binge eating disorder. The antidepressant fluoxetine is a medication that is approved by the Food and Drug Administration for the treatment of an eating disorder, specifically bulimia nervosa. This medication has been prescribed off-label for the treatment of binge eating disorder. Off-label medications, such as other selective serotonin reuptake inhibitors, have shown some efficacy, as have several atypical agents, such as mianserin, trazodone, and bupropion. Anti-obesity medications have also proven very effective. Studies suggest that anti-obesity drugs, or moderate appetite suppressants, may be key to controlling binge eating. Many eating disorders are thought to be behavioral patterns that stem from emotional struggles. For the individual to develop lasting improvement in a healthy relationship with food, these effective obstacles need to be resolved. Individuals can overcome compulsive overeating through treatment, which should include talk therapy and medical and nutritional counseling. Such counseling has been recently sanctioned by the American Dental Association in their journal article cover story for the first time in history in 2012, given the continued increase in obesity in the United States and the willingness of dentists to assist in prevention and interventional effort. Experts in obesity intervention in conjunction with dental educators should develop models of intervention within the scope of dental practice. Moreover, dental appliances such as conventional jaw wiring and orthodontic wiring for controlling compulsive overeating have been shown to be efficient ways in terms of weight control in properly selected obese patients, and usually no serious complications could be encountered through the treatment course. Summary of addiction-related plasticity. As well, several 12-step programs exist to help members recover from compulsive overeating and food addiction, such as Overeaters Anonymous and others. A review on behavioral addictions listed the estimated the lifetime prevalence rate for food addiction in the United States as 2.8%.